Hi, and welcome to iTenif Healthcare Solutions webinar. We're excited to be presenting Prepare for Unexpected Downtime Solutions in Business Continuity with ChartGuard for athenaClinicals. My name is Chelsea Grover, and I'm the Marketing Communications Coordinator for iTenif. I'd like to take a moment to explain the process for today's presentation. First, I'd like to mention that this webinar will be recorded, and we'll send out a copy of the slides along with the recording within the next week. Next, for those of you who aren't familiar with iTenif, I wanted to share a bit of who we are with you. Our goal in life is to make delighted clients by helping them get the absolute most out of their healthcare software investment. We're passionate about providing solutions for our healthcare provider partners, which in turn help them to improve patient care, enhance the patient experience, and maintain a financially healthy practice. Okay, so some housekeeping notes for today's presentation. At the end of the presentation, we'll open the floor up to questions from you. We'll answer all the questions at the end, but you may type them in the questions area of the webinar control panel whenever they occur to you. And finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. And again, questions may be entered in the questions box. Okay, so as we get started today, I thought it'd be fun to start the webinar off with a couple of polls just to see where you're at. So if you take a look at your screen, I would love you to answer which sentence best describes your interest in this webinar today. A, proactive, so we are prepared if we lose EHR connectivity. Or B, reactive, we lost EHR connectivity and we don't want to repeat it. So if everybody will take a quick look at their screens, we'll get these answered here. And we will close this poll in 5, 4, 3, 2, and 1. Okay, it looks like a lot of people are reactive. Looks like they've recently lost some EHR connectivity and realized what a nightmare that is and are looking for a solution to keep that from being such a bad experience next time. So one more question here. Finish this sentence. If we lost connectivity to our EHR, would it disrupt our patient visits? Everything in the office would come to a stop. We could possibly lose billing. It would impact our productivity, or patient care might be impacted. So select whatever one is most, I don't know, important to your organization, or what area you think might impact you the most. There was an option to begin with that I deleted that said it wouldn't impact us at all, because I decided that's just not true. This impacts everybody somehow. So we will close this poll in 5, 4, 3, 2, and close. Okay, so it looks like this one had a lot of people weighing in saying it would disrupt our patient visits, or we could possibly lose billing. So with that in mind, I think that we can go ahead and get started with this. So let me quickly introduce the presenters for today. Tom Seco is iTenif's Business Development Manager and a subject matter expert on the product. And Joe Schultz is Director of Product Solutions at iTenif, which means that he and his team are the people that actually built ChartGuard and thus is going to be in a great position to talk about it. So Tom, why don't you go ahead and get started when you're ready?
Okay, thank you very much, Chelsea, and thank you everyone for joining our webinar today about accessing your patient records during unexpected system outage. Put together an agenda of what we're going to cover today. You'll learn why practices and health centers invest in this type of solution. We'll talk a little bit about EHR dependencies. We'll talk about how ChartGuard works in the Athena environment. We'll show you the output that's generated by ChartGuard. I'll give you a brief overview of iTenif and answer any questions that you have as well at the end. The format of the webinar is I'm going to take you through the main part of the slides of the presentation, and in the middle I'll turn it over to Joe, and he's going to talk about how the ChartGuard works in the Athena environment. So what we're talking about today is simply an easy to use business continuity solution, one that ensures that you are prepared for a downtime situation at each of your office locations or clinic locations, and then 2, that you have access to your EHR charts during a downtime situation. A little bit about the dependencies. We all know that our EHR systems are based on complex technology. Between our own systems and our third-party hosted systems, we have servers, we have workstations, we have tablets, we have scanners, we have internet connections, we have local area networks, we have T1 lines, fiber lines, VPNs, wireless routers, wireless base stations, we have power systems, cooling systems, and behind each one of these components, we have software that runs as well. So when we lose access to our EHR system, it impacts our practice, it impacts our health center. Our quality of care can possibly be impacted because we do not have access to the patient's health record, and we may not be able to recall all of their history. So when that happens, we have to start asking questions, and maybe we have to start asking a lot of questions, which can lead to taking more time than usual. And when we take more time than usual, that can lead to lower productivity because we're taking so much time now. We can lose revenue as well because maybe we have to turn away patients, or maybe because patients are becoming frustrated, so they have to get up out of the waiting room and they end up leaving and making an appointment to come back sometime later. So all of this complexity in our technology, as I mentioned, any one of these components can fail, and if they do, that leads to us losing access to our EHR systems. Because we become so dependent on our technology, and it nearly works all the time for us, we tend to put how outages occur in the back of our mind and not really think about it. So it's always good to take a minute and recall some of the examples of why systems fail. Periodically, I go out and do research on outages and have put together a slide capturing some of this over the years. You'll see here, when the outage occurred, where it occurred, why it happened, what the effect was, the duration of it, and the type of outage that it is. The point here is that things happen that are out of our control, and some of them happen because of mechanical failures like HVAC systems and sprinkler systems. Some of them happen because the computer hardware failed. Some of them happen because software failed. Some of them happen because nature caused them to happen, such as fires and storms and things like that. Some are caused by humans, people with good intentions who make mistakes, and people who have bad intentions and want to cause disruption and chaos. So it's just a reminder on this slide as to why these things occur to us. They are out of our control. That's why they're unexpected, and we should be aware that these types of things happen. There have been some studies that have been done over the years with regards to what downtime can cost an organization, a healthcare organization. And some of those studies have found that it can cost as much as $488 per hour per provider. So it can be quite expensive. 10 provider practice down for 4 hours, it can cost as much as $19,520. Again, that's a significant amount of money. Because we have situations that can affect our EHR systems, HIPAA has a clause that says that we should have a contingency plan or plans for responding to various emergencies or other situations that can impact our EHR systems. So what are the options when we have an outage? So we can temporarily close the practice or close the location. We could go to paper charts, but that's becoming increasingly difficult for us to do nowadays because we're so dependent on our EHR systems. We can invest in redundant technologies. So we could add additional network connections. We could add additional power systems. We could implement a solution that ensures that you're prepared to handle a downtime situation. Thing to keep in mind is that if you really think about it, any systems that have to access outside of your current environment, so if you're a third-party hosted system, they usually have implemented some type of redundancy in their environment. There's still a component in that chain that can break. So, if you lose access to your system, you still have to get out to the internet to get to your connection. So, as we reflect on just what I talked about, that our systems are complex, that our systems are dependent on many components, that downtime is caused by unexpected events that are beyond our control, that downtime can impact our revenue, can impact our productivity, can impact our quality of care. And as you think about these things and reflect on what our options are in a downtime situation, some of the questions that you should be asking yourselves and we should be asking ourselves in this situation are, do I pursue an uptime? Do I pursue the uptime solutions, or do I pursue a solution that enables me to continue on with my business until the thing comes back line? Meaning, do I invest in more technology? Do I invest in more redundancy? Do I invest in more power systems because those are costly, or should I invest in a solution that makes sure that I can continue to operate on the clinical side while, in this case, Athena is trying to come back online? Am I going to be reactive or proactive in my clinic's preparedness for downtime? Am I going to be reactive, meaning I've already had an outage and I want to implement a solution that enables me to continue on with my business? Or I'm going to be proactive, meaning I haven't had an outage yet, but I want to be prepared in case I do have an outage, and it's most likely that I will at some point in time have an outage, so I want to be ready for that. Another question I'd be thinking about are, what are the types of impacts that a downtime incident can have on our practice, on our clinic? Those impacts, as I mentioned, revenue impacts. What type of revenue impact can it have? Can I have a productivity impact? Can I have a quality of care impact? So think about those types of impacts that I could possibly have on my practice or my clinic. And then think about how significant can that impact be based on the duration of the downtime incident. So if I'm down for an hour, what kind of an impact would that be on my quality of care to my patients? What type of an impact could that be on a revenue-based situation? What kind of impact could be being down for an hour be on productivity? If I'm down for 2 hours, what kind of an impact would that be? How significant of an impact would that be on revenue? How significant an impact would that be on productivity? How significant of an impact would that be on quality of care? If I'm down for 3 hours, if I'm down for 4 hours, think through those scenarios and do a little thought process on what those impacts could mean to our practice and to our clinic in those impact scenarios that you went through and identified earlier. And then think about, how can I minimize the loss? How can I minimize the disruption when I have a downtime situation? So how can I minimize, the loss of revenue? How can I minimize the disruption to my patients? How can I minimize the loss of productivity? How can I minimize my quality, the impact on quality of care that I could have, or disruption of quality care of care that I could have to my patients? So think about these questions as you're going through this process and how it affects your organization. The question should not be, will my clinic lose connectivity? Because you should be prepared for an outage, even though you haven't had one yet. If you're lucky enough not to have one yet, you should be thinking about that, because they do occur unexpectedly, and they occur, as we learned, from many different instances and types of outages. So as we have as we had talked to our clients and explored these situations with our clients, and they thought about it, they came to us and asked us to develop a solution that could help them. And this is how ChartGuard came about 10, 12 years ago. So we developed a solution that is cost-effective and easy to use business continuity solution. It ensures, one, that you're prepared for a downtime situation at each of your office locations or clinic locations, and then two, that you have access to your patient charts during AHR downtime. So very, very simple, as I mentioned earlier. So now I'm going to turn it over to Joe, and he's going to take you through how ChartGuard works.
All right, thank you, Tom, and thank you to those attending today. We appreciate you taking a few moments out of your day. When we originally started working on ChartGuard a little over a decade ago, we were working with some clients to solve the problem of what do you do when you lose access to your EHR but you've also lost access to your, technology chain, what Tom was talking about, all these pieces of technology that mostly work every day, right? It's an aligning of the planets, and when something gets out of alignment, you lose access. So in discussions for how we were going to work with them to build what became ChartGuard, we decided that we couldn't really be dependent on it being a cloud-based solution when you're having the outage, because one of the most common outages we see is on the network side, whether it's loss of domain name services or it's just the network line being cut, things like that. So the architecture behind ChartGuard is really about grabbing your data during the night from the EHR, running it through an engine that'll assemble it into a PDF file that's human readable and can be read on virtually any computer device, and pulling that file down to each department where the patients are scheduled to present at. All right, so this way you have the data out there at the location when you need it, when the network goes down, all right, when you lose access to Athena. So it's already there, and we do that looking forward several days. So if you have an outage that spans overnight, maybe it's late in the afternoon and the network people aren't going to get out there till the next day, that type of thing, you have that data sitting out there that you can keep using. So what does this look like in the real world? Well, in the Athena realm, you have your cloud that Athena runs in, right? You log into it, they host everything, and for the most part, it's great, it just works. So what we do is we look at your database in the Athena cloud, and with your authorization, the ChartGuard engine, so that's the iTenv cloud on the upper right there, the ChartGuard engine pulls only the data it needs, assembles it, and creates these PDF files. You get one per patient, so each patient has a unique one. It's not one giant Uber PDF file. This way we keep everything segregated, so there's not two patients in each one. But it does all the processing to assemble the database data, document data, image data that you need into these PDF files. And then at each of your departments, an agent wakes up and pulls down this encrypted package of PDF files and can unencrypt it and make it usable when you don't have access to the network. So each morning, early in the morning, it's going to wake up, pull down that data for several days in advance, and you're going to have it there within the four walls of that building when the network goes down or when you lose access to Athena. So that's really the uniqueness of this solution, is that we're giving you a low technology footprint when your system's down, because when your system's down is not the time to find out you can't get access to your cloud-based archive of your clinical data, right? This way you have it there on site so you can get to it. It's PDF files, so you can print them straight to paper if you want to put them in a manila folder and take it in back with the patient, or if the network within the four walls of that department is still up, you can access them internally electronically from that computer that downloads them. So it gives you a bunch of different options. And that's really what we're shooting for here, is giving you the clinical data at a time when you're technology challenged. And this is really the diagram that we're showing here. Pulls from Athena, creates the PDF, then your departments wake up and pull down those encrypted packages of the PDF files. So what do those PDF files look like? What's in them? So we'll go to the next slide and kind of break that down, and then Tom will show you the charts. So each department is going to get an appointment listing, because if you have all these PDF files, it's useful to know what time people are coming in, and that way if you are printing them to paper, you can kind of print them just ahead of the appointment time, so you're not sitting there with all this PHI sitting there on paper. And then the PDF files themselves, the chart for each patient contains the items that are listed here on the screen. I won't read through all of them, but what I do want to point out is that you can limit the depth of this information. So if you've had a patient that's been seeing you for 10 years, you probably don't need that appointment from 10 years ago when you're having a downtime situation, right? You probably just need the last several appointments and the data that goes along with them. So in the configuration of ChartGuard, we can kind of set that scope and depth of what's going to be pulled into those charts. One, to reduce the amount of PHI sitting there, and two, to make the PDF files, especially if you're printing them to paper, more reasonable. So what you normally see is just some of the discrete clinical data in the first section there. And then we see clients wanting a lot of just, particular summaries, right? Encounter summaries, and maybe it's generic ones and specialty-based ones, but we can work on getting that configured for you. And what we'll do is we'll generate a set of these, and your clinicians can go ahead and, sign off on that we have the right things that they need for a downtime situation. So that's what's really great about this, is it's configurable. We're not, telling you what you need. We're giving you the options, and we'll give you kind of a baseline to start with, and then you come back to us and tell us how you need it adjusted to make these PDF versions of the patient charts useful during downtime. Tom, if you want to go to the next slide. All right, I'll let you go ahead and show the sample PDF.
Okay, all right, thank you, Joe. So this is what the PDF file looks like. As Joe mentioned, the first part is the demographic information. So you have the information about the patient, you have their insurance information, primary and secondary insurance, and then as you scroll down, here's the information on the allergies, and you see it's in a nice table format and easily readable. So you can scroll down to the next section. Here's the medications. So you can scroll down, and as Joe mentioned, you can control the depth of information. So you can control it by time. So give me all the information in the past 6 months, or you could say, give me the last 3 instances that occurred. So they could, 3 instances could have been in the past 1 month or 2 months, or it could have been over the past year. Here's our problems. And then we also bookmark the sections as well. So it makes it easy to get to a particular section that you need to take a look at. So if you wanted to take a look at the vital signs, you quickly go down here to the vital signs and take a look at it. If you need to go back to the medications, you can go back to the medications. So you have 2 ways of getting to the information, scrolling from top to bottom, or by using the bookmarks and going specifically to the section. This is what the images look like in documents, so you can see what those look like. As far as the medical record. So that's what the document looks like from the patient chart that gets generated. And again, go to each section using the bookmarks or scroll from top to bottom. So a little bit about, this is a testimonial of one of our clients. So this is an orthopedic practice in Tennessee. They took time to write us a quick email after their experience using ChartGuard. They're a fairly large organization now. They have about 20 locations, and they've been using ChartGuard for several years. They purchased ChartGuard several years ago, and about 6 months after they purchased it, they had an outage at 2 of their largest clinics. And prior to implementing ChartGuard, they typically closed the clinics that were being affected by an outage and had to turn away patients. When they implemented ChartGuard, they were able to see their patients with minimal disruption using the charts that I just showed to you and an appointment listing that Joe had mentioned. And they were able to keep the clinical side of the practice functioning while their IT team was working to bring the HR system back online. So the network manager took the time to write us a quick email to tell us how their experiences went. And you can see their physicians were quite pleased with using ChartGuard. So a little bit about us and who we are. We were founded in 2003, and we have 20 plus years of experience with EHR and EPM systems. We have 47 employees in the company from coast to coast, and we have worked with over 350 to 400 clients that use EHR and EPM systems. As far as next steps go, we just gave you a high-level overview of business continuity and in our ChartGuard product. So if you have an interest in learning more about ChartGuard and how it would work within your organization, here's our email addresses and phone numbers. You can send us an email or give us a call, and we can talk with you about it. If you would like to schedule a more in-depth demonstration and discuss in more detail about how the product would fit within your organization and give you the opportunity to ask questions as they specifically pertain to your organization and to your processes, we're more than happy to do that as well. So with that, we'll take some questions.
Okay, perfect. Thank you so much, Tom. And again, thank you everybody for joining us today. Questions can be entered in the questions area of the webinar control panel, and we're just going to go through them in the order that we received them. We only have a couple, so this should be pretty quick. But that being said, if you have them, now is a great time to ask because we only have a couple. Okay, so first question. Are we able to view these off of our phones, or do we have to use tablets or printed paper?
The good news about using the PDF files is there's a reader available for virtually every computer platform. So you can do it on phones, you can do it on tablets, you can do it on laptops. So there's, almost no limit within your network and within your security scheme what you can view these on. We have clients that some of them use tablets during the outage, some of them print them to paper. So it basically gives you a lot of different options when you're technology challenged during an outage. So that's the good news, and that was intentional in the design and part of the reason for picking the PDF files.
Perfect, thanks, Joe. Next question, what's the average cost?
Well, there's four components to our pricing. We have the license fee for the product. We have the installation, training, configuration fee. We have our annual software maintenance fee, and then we have our annual hosting fee as well. So there's four components to it. More specific pricing, I would have to talk with you about that because it's based on practices and number of practices. So we have a professional license and enterprise license.
Okay, thanks, Tom. That kind of leads into the next question. Does ChartGuard work with large groups who have over 100 providers?
The answer is yes, it does. We actually, when we took ChartGuard into the Athena space several years ago, we worked with two very large Athena groups. So we cut our teeth on the big groups instead of starting out with a small group and, then later on having scalability problems. So we kind of jumped into the pool, in the deep end. But the good news for you is whether you're a small practice or a big practice with many departments, the impact is the same, right? If you only have a few providers and they can't see patients, that's just as bad to your practice as having 100 providers who can't see patients. So it's useful in either case, and the good news is it's applicable to both smaller groups and large groups.
Perfect, thanks, Joe. And it looks like this might be our last question. Can we use ChartGuard to give a patient a readable copy of their medical record?
You can, there will be kind of a delay. The way clients have done this in the past is they've basically put kind of a dummy appointment on the schedule. It'll generate the chart, and then the next day they'll have that PDF that they can hand off to the client. So that is absolutely an option.
Okay, perfect. Well, it looks like that's all the questions that we've received so far. If you think of a question after the fact, you see both Tom and Joe's information up on the screen. You can reach out to them directly. Otherwise, feel free to reply back to the email that I'll be sending out in a couple of days here with a link to the recording and the slides. Basically, any way that you can get a hold of us, we're happy to help. That's why we're here. We're here to answer your questions. So don't think it's a silly question. We've heard them all. We're happy to help. And with that, I hope that you have a great day and stay healthy and safe and have a wonderful week.
Thank you, everyone.
Thank you very much. Have a great day.